Hello guys, welcome back to Clinically Clear. So today we'll be covering a very long topic in terms of the volume, but it's not that hard and it is quite important. So contraception. Contraception is basically preventing pregnancy, right? There's a definition in Parks, a detailed definition. I haven't added it. Please look into it yourselves. I'm just going to cover the methods of contraception. So first we have temporary methods or spacing methods when you want to, space two different children, or temporary methods of contraception. We don't want to permanently sterilize. Here you have natural methods. Natural methods, there is no device, there's no chemicals. Okay. First of all is sexual abstinence. Sexual abstinence is basically not having intercourse. 0% failure rate. That is the only advantage. Disadvantage is it can cause mental problems like, repression of the sexual desires. It can lead to nervous breakdowns, emotional problems. So this is about sexual abstinence. Then coming to coitus interruptus or withdrawal method. Basically, what is withdrawal method? The penis is withdrawn from the vagina just prior to ejaculation. The disadvantage of this is high failure rate due to pre-ejaculatory secretions containing sperm. So even the pre-ejaculatory secretions from the penis can have sperm leading to fertilization. That is why coitus interruptus has a high failure rate. Rhythm method or calendar method or safe period. Safe period is basically what? In a menstrual cycle, if menses starts here, the first 7 days and the last 7 days of the menstrual cycle is the safe period. Basically, is the infertile period. The remaining period, fertile period, where if the sperm enters the vagina, if the sperm enters the female reproductive tract, it can lead to fertilization. So, first 7 days and last 7 days of the cycle is the safe period. That is known as a rhythm method or calendar method. Also known as Tirumala bead method. Basically, what is a Tirumala bead? A Tirumala bead is, this is a Tirumala bead. See, you have a red bead, you have a red bead, you have a few brown beads, and you have a movable rubber ring. Basically, what happens from this movable rubber ring every day is moved by one bead. Okay, as long as you're in the brown bead, it's the safe period. Once the movable rubber ring eventually makes it to the white bead, it is the unsafe period, the fertile period where you have to avoid sexual intercourse. Again, once it makes it back to the brown bead, it is the safe period. And this dark brown bead is here indicates the 26th day of the cycle. Okay, if the second cycle starts, if once again the woman goes into menstruation before this dark brown bead itself, it indicates that the cycle is a short cycle. Okay, so red bead, you have a movable rubber ring, Tirumala bead, red bead for start of menstruation, brown bead for safe period, white bead for unsafe period, and dark brown bead to indicate the 26th day. Now the advantage is even tribal women can use this. Very easy to explain. You don't need to, have any education. It's not some oral contraceptive pill that you have to take, these many pills within 72 hours. Some details will be there, right? Here, no, it is just a bead. You have to just tell them you have to avoid sexual intercourse in so and so days. But the disadvantage is women who have irregular cycles, short cycles lesser than 26 days, long cycle more than 32 days. See, this bead has a fixed number of beads, that is approximately 32 beads. So the cycle is longer than 32 beads, then also it is useless. Cycle is shorter than 26 beads, then also it is useless. Irregular cycles also it is useless. This is rhythm method or calendar method. Then you have two physiological methods. Basal body temperature method is that during ovulation, due to the thermogenic effect of progesterone, the basal body temperature increases by 0.3 to 0.5 degrees Celsius. Okay. Cervical mucus thinning method, also known as Billings method, says that day 0 to day 7, cervical mucus relatively remains dry. But after that, till ovulation, you have increasing production of thin watery cervical mucus, and on the day of ovulation is the thinnest, most elastic, most copious amount of cervical mucus, and after ovulation, because of progesterone, the cervical mucus eventually gets thick, tenacious, and becomes like a mucus plug. So this is about cervical mucus method. At ovulation, thinnest, most elastic, copious cervical mucus. At ovulation, rise in body temperature by 0.3 to 0.5 degrees Celsius. Now, the biggest problem is these are better tests for fertility than contraception methods. Basically, will you, if you, okay, fine. Today, a woman's basal body temperature increased by 0.3 to 0.5 degrees Celsius. So, today is your ovulation, so you should not have sexual intercourse. But what if you had sexual intercourse 2 days before and then the semen or the sperm is still within the reproductive tract? It can lead to fertilization, right? So, that is why these are better tests to indicate fertility. But then there is a method known as symptothermal method, where if you combine basal body temperature method and Billings method or cervical mucus method, it is a slightly more effective method of contraception. But by themselves, not symptothermal method, by themselves it is a better test for fertility. Next one is lactational amenorrhea, which is for about 6 months postpartum. Basically, for 6 months postpartum, due to increasing prolactin, it inhibits the release of FSHLH. When FSHLH is inhibited, there is no ovulation, so amenorrhea. But the main problem is there's a high failure rate. Just because you can't rely on prolactin inhibiting ovulation for 6 months, so we combine lactational amenorrhea with something known as progesterone only pills, POPs, which I'll come to later, for effective contraception. So these are all the natural methods, no devices, no chemicals, nothing. Okay. Next, coming to the barrier methods. Barrier methods, they act as a physical barrier or a chemical barrier to prevent sperm to come in contact with ovum, leading to fertilization. Of course, physical methods, first of all, we have condoms. Most common method of contraception, male condom, put on an erect penis, latex, made of latex, and Government of India refers to it as deluxe Nirod. Nirod or deluxe Nirod, made of latex, placed on an erect penis, that is male condom. Female condom is inserted into the vagina. It can be made of nitrile polymer or latex or polyurethane. And here mainly, as you can see, you have two rings. You have a wide open external ring. The external ring towards the opening of the vagina is an open ring, and the internal ring is closed. Of course, if the internal ring is open, there is no point, right? Closed internal ring in the female condom. This is about female condom. And the biggest advantage of both of these methods are they are easy, cheap, safe, and they prevent STDs like HIV and AIDS. Very important advantage. Condoms not only prevent pregnancy, they also prevent the spread of STDs. Disadvantages: using condoms decreases the pleasure during sexual intercourse. Female condom is less effective than male, and the main failure rate, whatever failure, contraceptive failures you have from condom, even more than the condom breaking, it is due to the improper usage. The person does not wear or put on the condom properly. That is the reason for failure most of the time. So this is about male condom and female condom. Next, coming to diaphragm or Dutch cap or cervical cap or vault or vimule. Basically, as you can see, it is like a cap. Okay. Cervical cap, it is not inserted into the vagina, it is inserted into the cervix before sexual intercourse. And you should keep it for 6 to 8 hours after sexual intercourse. So do not immediately take it off. So insert it into the cervix before sexual intercourse, and remove 6 hours after sexual intercourse. It can be impregnated with spermicides. The advantage, it does not prevent all STDs, okay? It cannot prevent HIV, AIDS and all, but it can prevent human papilloma, HPV exposure. It can prevent pelvic inflammatory disease, and it is safe. It has some advantage. Not entirely safe, because the biggest disadvantage is if you don't remove it within 6 hours. If it is left in place for a prolonged duration, it can lead to toxic shock syndrome. This is a very important disadvantage when it comes to cervical cap, diaphragm, Dutch cap, vimule, vault. All of them are the same. Put it in the cervix before sexual intercourse, remove it 6 to 8 hours later. Could be impregnated with spermicides, prevents pelvic inflammatory disease, HPV exposure. Prolonged duration can lead to toxic shock syndrome. Then coming to vaginal sponge. Vaginal sponge is also inserted into the vagina before sexual intercourse. Here it is inserted into the vagina before sexual intercourse, and it is also removed 6 to 8 hours after sex. Here also biggest disadvantage why it is not used is because if left in place for prolonged duration, toxic shock syndrome. Same thing happens here also. If you leave it for too long, beyond 6 to 8 hours, like 24 hours and all, it will lead to toxic shock syndrome, which is very dangerous. And vaginal sponge, they are both physical and chemical method of barrier contraceptive. Physical, why? Because you have a sponge in the vagina obstructing the sperm. Chemical is because this vaginal sponge is impregnated, just like how cervical cap is impregnated with spermicide. Vaginal sponge is also impregnated with a spermicide known as nonoxynol 9. This nonoxynol 9, it disrupts sperm cell membrane, so it is a spermicide. That is about vaginal sponge. So physical methods, you have condoms, diaphragm, and vaginal sponge. Vaginal sponge, nonoxynol 9 spermicide, disrupting sperm cell membrane. Physical, obstructs the sperm flow in vagina. Not used because of toxic shock syndrome risk, and inserted into the vagina before sexual intercourse, removed 6 to 8 hours later. Chemical barrier methods. Chemical barrier methods, you have foams, spermicide paste, spermicide jellies, spermicide pessaries, soluble films. All of these are easy to use. They are just applied onto the vagina before sexual intercourse. These spermicide foams, jellies, paste, they are applied onto the vagina. And these spermicides, they bind to the surface of the sperm, they inhibit oxygen uptake or some other mechanism, and they kill the sperm basically. Okay. Example is Fexi. There is a spermicide known as Fexi, which is lactic acid, ascorbic acid, potassium bitartrate. Okay. You have two acids. So when you do that, the vaginal pH becomes extremely acidic. So this can also kill the sperm. So this is known as Fexi, this spermicide. So these are certain examples for chemical spermicides. And the disadvantages, these could be irritants leading to local irritation. And if pregnancy has already occurred, it can have teratogenic effects on the fetus. So these are the chemical barrier methods: foams, jellies, pastes, etc. Spermicides like Fexi, acidic environment, they inhibit oxygen uptake in the sperm. Easy to use, just apply it onto the vagina. Disadvantages: local irritation and teratogenic effects on fetus. Then coming to IUDs, intrauterine devices. Intrauterine devices, they are short, stiff frame inserted into the uterus through the vagina. Okay, they are inserted into the uterus through the vagina. All of them have a barium core. Okay, except copper nova T, which has a silver core. Why barium core is because when you do an X-ray on a woman who has a IUD inside her, you should be able to see that there's an IUD inserted. So to make it radio opaque, that is the point of barium core. Okay, there are three generations of IUDs. First generation IUDs, inert IUDs, no hormone, no copper, nothing. Okay, example is Lippy's loop, where you have a double S shaped with two nylon threads attached to the lower end. That is Lippy's loop. And you also have something known as Grafenberg's ring, which is just a flexible silver wire ring. These are the inert IUDs. That's all. They are just inserted into the uterus. Their mechanism of action I'll come to later. Second generation is copper containing IUDs like copper 200T, copper 220T, copper 380AT, copper Nova T, and copper 375 multi-load. Copper 375 multi-load does not have the letter T in it. It is important. Why it is important? I'll come. Okay. Now, if you are differentiating between copper 380AT and copper multi-load 375, okay. See, copper, because it is a copper containing IUD, 380 because it has 380 mm square of copper, surface area of copper in it. A, because it has copper in both the arms and the stem. Understood? T, why? Because it is T-shaped. You have your answer from there only. You got a few differences. Whereas copper multi-load 375 has copper only in the stem, no copper in the arms. It has no T. Very important. You should not put T in multi-load 375 because it is inverted U-shaped. And here it has something known as spurs. You can see the arm gives rise to certain projection known as spurs, whereas copper T 220, copper T 388 does not have any spurs. Okay, does not have any spurs. And at the lower end, copper T will have two white polyethylene threads attached, whereas multi-load 375 has a single monofilament of a blue or a green nylon monofilament attached to the lower end. This is one more difference. And biggest difference is 10 years. Copper T388, 10 years duration of action. Copper multi-load 375, about 3 to 5 years. And but the advantage of copper 375 is it is very easy to insert it into the uterus. You don't need any plunger. You just take the UID inserted tube and you place it in the uterus. Whereas for copper T380A, you need to insert it into the uterus by pulling the IUD inserted tube back using a plunger. Now you can watch a video on this about how to insert an IUD. It is not possible to explain it in words. So this is about how to differentiate between the second generation IUDs, mainly copper 380 and multi-load 375, T-shaped, U-shaped, copper in arms and stems, 380 mm square, copper only in stem, 2 white threads, polyethylene, 1 blue-green nylon monofilament, no plunger required, plunger required, no plunger required, spurs present, spurs absent, 10 years validity, 3 to 5 years validity. This is about second generation. Third generation copper IUDs are hormonal IUDs. Okay. You have Mirena or LNG20 and Progestasert. Okay. Mirena is like a curved T with bulbous ends to the arm and 2 threads attached. Progestasert is just a tubular T. That's all. No threads, nothing. That is how you differentiate with based on how it looks. Mirena has 5 to 7 years of action, Progestasert only 1 year. What does Mirena contain? It is there in the name. LNG20, levonorgestrel. 20 because it releases LNG at a rate of 20 micrograms per day. Progestasert, it contains natural progestin, releases about 68 micrograms per day. Okay, that is Progestasert. The advantage of Mirena is it has the Pearl's index of less than 0.3%. That is failure rate, contraceptive failure rate very low, less than 0.3%, and there is no risk of any ectopic pregnancy, nothing. But the disadvantage is highest expulsion rate, highest removal rate. You know, women want to get it removed or it gets expelled from their uterus. Highest is Mirena. Okay, and Mirena is available in India. Whereas Progestasert, it is advantageous. It has the lowest expulsion rate, but main disadvantage of Progestasert is high rate of ectopic pregnancy. That is why it is not used in India. Progestasert, natural progestin 68 micrograms per release rate per day, not used in India because of high rate of ectopic pregnancy. Okay, this is about hormonal IUDs. Mirena or LNG20 contains levonorgestrel, 20 micrograms per day release rate. Advantages: very low Pearl's index, no risk of ectopic pregnancy. Disadvantages: high expulsion rate and available in India. Then Progestasert, just a tubular T, only 1 year validity, high rate of ectopic, lowest expulsion rate is the only advantage, and it is not available in India. 68 micrograms per day, natural progestin. Progestasert, natural progestin. Then comes mechanism of action. See, think of inert IUDs. They don't have copper, they don't have hormone. So what they do, they induce something known as foreign body reaction in the uterus, which makes the uterine environment very hostile. What do you think copper IUDs do? They alter the biochemical environment. Example, copper ions, they decrease the sperm motility. That is copper. Hormonal IUDs, basically they contain progestins, either synthetic or natural. They thicken the cervical mucus plug, so they prevent sperm entry. So all these, yes, they inhibit both fertilization and implantation, but the main action of intrauterine device is always inhibiting fertilization. Understood? Main is always inhibiting fertilization, but it also inhibits implantation. Foreign body reaction, altering the biochemical environment, copper ions decrease sperm motility and thickening of cervical mucus plug. Time of insertion. Whom will you insert IUD in? Ideally, the ideal candidate for IUD is the woman has one child, normal menstrual cycles, no history of any pelvic inflammatory disease, checks the presence of threads every day. Okay, so in this normal female who is non-pregnant, You will insert the IUD between the 5th day and the 10th day of the cycle. Very important. When will you insert the IUD? Between the 5th day and the 10th day of the cycle. But there are other methods of insertion as well. Example, just 10 minutes within the delivery of placenta, post placental insertion into the uterus. Between 10 minutes to 48 hours post delivery, postpartum insertion. After 6 weeks of delivery, post purpureal or interval insertion. Between 48 hours to 6 weeks, we do not insert IUD. Don't mark anything there. Between 48 hours to 6 weeks, no insertion of IUD. Post abortum insertion, after an abortion, 12 hours or 12 days after a surgical abortion, 15 days after a medical abortion. Intra-caesarean insertion, during a caesarean surgery only, you can easily place the IUD. You don't need any IUD inserted tube, nothing. So what happened? Ideal candidate, one child, no pelvic inflammatory disease, checks threads, normal cycles. Between the 5th day and the 10th day of the cycle, and insertion based on delivery times, within 10 minutes of placental delivery, post placental, between 10 minutes to 48 hours, postpartum, after 6 weeks, post 6 weeks delivery, uh, interval or post purpureal insertion, 12 days after surgical abortion, 15 days after medical abortion, post abortum insertion, and within the caesarean section, intracaesarean insertion. Okay. Complications. Think about it, think logically. You are putting some tube, putting a metal thing or a plastic frame into the uterus. It can, of course, cause bleeding. Most common complication, spotting or bleeding. Pain, most common cause of removal of IUD. Why do women who have the women go, okay, I want an IUD, but then they go back with pain saying they want to get it removed, voluntary removal. That is pain. Uterine rupture, think about it, you're putting something inside, it can rarely lead to uterine rupture. If not done under sterile conditions, it can lead to pelvic infections, especially copper IUDs, high risk of pelvic inflammatory disease. Not just infection, inflammation as well. Copper IUDs, high risk of pelvic inflammatory disease. Ectopic pregnancy, I told you, progestasert, ectopic pregnancy. Expulsion, the IUD can get spontaneously expelled from the uterus as well. So, most common, spotting or bleeding. Most common cause of removal, pain. Uterine rupture, pelvic infections, ectopic pregnancies, expulsion. Okay. So, based on these side effects only, you can get to know the contraindication. Absolute contraindication. Pregnancy, obviously, we won't stick an IUD up when the woman is pregnant. Current pelvic infection, very important. Current pelvic infection does not include HIV. HIV is a systemic infection. Current pelvic infection is stuff like, some gonorrhea or some reproductive tract infection. Then cervical cancer. Cancer is there, you won't put an IUD inside. Abnormal uterine bleeding. The most common complication of IUD is spotting or bleeding. Already patient has abnormal uterine bleeding. Why will you put IUD? Relative contraindications, unmotivated woman. Why do you want to force a woman who's not even motivated to use IUDs as a contraceptive? Dysmenorrhea, most common cause of removal is pain. Someone who already has painful cycles, will you give IUD? No. Anemia, most common complication is spotting or bleeding. Anemia, if a woman already has anemia, you will not give. Menorrhagia, woman already has heavy menstrual bleeding, no IUD. History of pelvic inflammatory disease. Current pelvic infection, current PID, current pelvic inflammation, absolute contraindication. History of pelvic inflammatory disease, it will be a relative contraindication. Any fibroids actually can come under both absolute and relative. Fibroids also is in it. You won't stick, already there's a tumor inside the uterus, you won't stick another IUD inside. It can lead to some bleeding, excessive bleeding or pain or something like that. This is about contraindications for intrauterine devices. I'll cover the rest of the contraceptives in another video. Thank you for watching.